SARS-CoV-2 Omicron's fast growth likely due to loss of vaccine-induced protection. SARS-CoV-2 Omicron VOC was shown to be more likely to infect vaccinated persons than the SARS-CoV-2 Delta VOC, according to a new medRxiv study. Vaccines against coronavirus disease 2019, COVID-19, are ineffective in guarding against infection and severe illness due to the introduction of novel SARS-CoV-2 VOCs. The Omicron VOC was shown to be less successful in neutralizing than the Delta VOC by sera taken from vaccinated people. The researchers compared SARS-CoV-2 positive rates for Omicron and Delta VOCs based on patients' immunization status. A monitoring effort in Southern Connecticut, USA, identified the Omicron variation utilizing sequencing and SGTF RT-PCR markers. 37,877 PCR nasal swab assays were collected. Each PCR test included the date, manufacturer, and court value of the COVID-19 vaccination delivered. The researchers then compared the Omicron and Delta VOC test positive rates to the individual's immunization status. According to a logistic generalized estimation equation model, the probability of Omicron detection was evaluated as compared to Delta detection. Yale University also ran a surveillance program to track Omicron's local emergence. Between December 12, 2021 and December 26, 2021, RT-PCR test samples were reviewed medical data. Each COVID-19 vaccine was administered with the patient's age, test date, and result. Less than 1% of nasal swabs tested positive for any variant. The current study found that Omicron VOC cases doubled every 3.2 days, 3.7 times faster than Delta VOC. Also, 71 to 74% of the people examined had received all vaccines. Unvaccinated individuals had a test positivity rate of 5.2% for Delta and 4.5% for Omicron, while those who had only received one vaccine dose had a similar trend. Those who had received 2 vaccination doses in 5 months had a positive rate of 4.7% for Omicron and 2.6% for Delta VOCs. People who got 2 vaccination doses more than 5 months earlier had higher rates of Omicron and Delta positive, whereas those who had 3 doses had lower rates of Omicron and Delta positivity. 1 or more doses of Omicron vaccine were available to 91.2% of the partly immunized people who had undergone RT-PCR testing. People who got 1 or 2 vaccination doses had similar Omicron positive rates as unprotected individuals, whereas those who received 3 vaccine doses showed a 49.7% drop in positivity.